Hi, welcome back to my channel. In this video, I will be covering the anatomy which came in 2023 exam. All of these are recall based, so yeah, but most of them are taken from a authentic source, so it will be beneficial for you. So let's just start. So there were two questions from the derivatives of pharyngeal pouches. So first of all, we should know all the derivatives of the pharyngeal pouches. So first, you have to know that there are five pharyngeal pouches. All right, 2, 3, 4, 5, and now I will tell you the derivatives, and you have to remember them just as them. So the first pharyngeal pouch derivative is tympanic cavity, eustachian tube, and eardrum. All right. Then in second we have palatine, tonsil, and tonsillar fossa. Then third, fourth, fifth. Then in third we have inferior parathyroid gland. In fourth we have superior parathyroid gland. And fifth is ultimo branchial body, which gives rise to the parafollicular C cells of thyroid gland. Now I will tell you a very easy way. First, in thymus also is present in third. I will tell you a very easy way to remember. So you just have to think of the way the location is based. See, first we will have ear, then we will have tonsil, then we will have parathyroid gland. But in this, remember, I comes first, S comes after that. That's why. Okay. Then fifth, ultimobranchial body. Basically, after parathyroid, and then you will have C cells, right? Okay, so this is what came, and the question was the first question was inferior parathyroid is the derivative of which pharyngeal pouch, 1 2 3 4. Then you know that it is 3. Then the second question was which of the following is the derivatives of the first. So in that, one of the options were eustachian tube. Also another name is auditory tube. All right. Yeah. So then second question was muscles which form the modulus. Now you need to know modulus is something like you have your lip and then you have some muscles, right? Here. So basically 9 muscles are responsible for forming modulus. So first of all is the zygo. You need to remember all of them. Zygomaticus major. Then you have buccinator. Then you have platysma. Then you have levator, anguli, oris. Then we have depressor anguli oris. Then we have depressor labii inferioris. Most important muscle, orbicularis oris. Then you have platis. Then you after orbicularis we have done 8. We've done 7. Then we have rhizorius muscle responsible for grinning, right? Yeah. Then mentalis. All right. So question was which of the following is not a component of modulus, and there was an option of zygomaticus minor. So in this list you cannot see zygomaticus minor, so that is why this was correct. Then skin over the angle of mandible. It is a very repeat question. Greater auricular nerve. All right. The greater auricular nerve. You should know that it is supplying the angle of the mandible. Then you can also remember that in front of ear you have greater auricular nerve supplying, and behind you have lesser occipital. All right. Then very important, one more thing, Erb's point, which is related to greater auricular nerve. Now this Erb's point, it is the basically on the posterior border of sternocleidomastoid. Okay, this is the point at which greater auricular nerve leaves cervical plexus. All right, so this is a Ames question, Erb's point. All right. Then visual field defects is very important. See, if you don't know the optic pathway, you can just remember these defects and then it will be fine. But I will also explain optic pathway. It was a question in 2020, so I will cover it then. Okay, to refer to that, you can watch that video. So first of all, you just need to know some of the defects, not all of them. So loss of vision in one eye. All right. Then we have temporal hemianopia. Then you have binasal hemianopia. Then left homonymous hemianopia. Then you have homonymous quadrantanopia and scotoma. Okay, scotoma. So first of all, loss of vision in one eye is by the ipsilateral optic nerve. Okay, just remember this list. Bitemporal hemianopia and binasal, both of them are by optic chiasma. Left homonymous hemianopia, so right optic tract or radiation. Then homonymous quadrantopia, like basically you divide it like this. Okay, so either it can be upper or it can be lower. If it is upper, it is related to temporal, okay, region, and if it is lower, it is related to parietal region. Now where is the defect? It is the defect in the contralateral optic radiation. All right, remember these also. Okay, then scotoma. In scotoma you have to remember occipital region. All right, so loss of vision in one eye is ipsilateral, bitemporal is optic chiasma, binasal is also optic chiasma. Then left homonymous is right auricular. Then homonymous quadrantopia is upper and lower. Okay, then scotoma is occipital region. Now talking about the pterion. Now it is a H-shaped suture, right, which we see, and basically it has middle meningeal artery in it. Now anterior trunk is also present and posterior also present. Now this is the one which is responsible for extradural hematoma. All right, anterior trunk, remember anterior trunk because in questions it is asked. Now in this you have to remember one key feature, that is, you can't forget it, lucid interval. Okay, now coming on to nucleus associated with addiction. This is also a repeat, you can just remember it as acubens. Okay, and neurotransmitter is glutaminergic. Okay, so this question, then there was question of myocardial infarction due to occlusion of circumflex. See, I will cover the circulation in some other video. So the answer was left atrium and ventricle. All right, and some papillary muscles also. So there was once a question in 2023 in which we were given a chest x-ray of the arch of aorta, and we were asked to basically you were given a chest x-ray and you were told to identify the structure marked with an arrow. So it was arch of aorta. I had to add the photo, I forgot to add it. So yeah, so we can just use this, I guess it should be enough. Okay, so out of these I think we can use this one. So yeah, so like you were given this same x-ray but like not the labelings, and you were asked to tell which is this one. So this was arch of aorta, so we'll just go through it once. So this is clavicle, arch of aorta, pulmonary artery, hilum. The things that I wanted to know is left atrium, left ventricle, right ventricle. Okay, trachea is also sometimes asked. Carina is the bifurcation point of trachea. Okay, cardiophotic angle you should know because you have to do in general medicine. Then yeah, this much is fine. Then there was one more question. Structure responsible for maintaining the tone of cardiac walls is chordae tendineae. Alright, so these were the questions of anatomy. If you like the video, do subscribe to my channel. Thanks for watching.